Where to begin on this one?
Well, you know what? I do. Because this is really close to my heart because it is so important that our kids have sex ed in school. So much so that I actually taught sex ed in my son's 4th through 6th grade classes. Really actually, devised a curriculum. It's really important, and I did this because I got so frustrated seeing how many young women had unintended pregnancies and STDs, and it all started from early on because they weren't taught about their bodies, they didn't know about their bodies, so it's really important to know. So you do have to have a curriculum because in the U.S., we have the second highest unintended teen pregnancy rate of all industrialized nations. 750,000 a year unintended pregnancies happen between the ages of 15 and 20.
That's not good.
So what if we
good.
agree that sex ed is so important, and in the past it was lacking, but how about this? Talking about oral sex with braces?
No.
How about doggy style, sadomasochistic sex play?
That's
this is some
where it
stuff
goes
that's on the
too far.
website.
How about
That's where it goes too
condoms
far.
for first graders?
Right.
When I was in 1st grade, if somebody had handed me a condom, I would have blown it up as a balloon or something.
It has to be, and speaking to these school boards, it has to be age appropriate, comprehensive, and the key word is age appropriate. You don't have to talk about that. You don't have to tell a kid how to have sex, just what the consequences are and trying to stay away from it. And that's what these really need to focus about, and about feeling good about their bodies and what's happening to their bodies. It's a continuum. That's why a lot of times they call it family life education instead of sex
So where
ed.
do you draw the line? Because let's talk about this. Sex education should obviously include ways you can catch sexually transmitted diseases,
How to protect
respect
yourself.
for your partner, protecting yourself. But again, back to this particular sexual education curriculum, there are sample assignments where it says, go to your nearest pharmacy, check out the condoms
Parents
and
have to get
contraceptives.
involved
Is that okay?
in this. The parents have to get involved in this. Most of them have an opt-out, but they have to get involved and they have to know what's on the curriculum because they can say, this is not what I want, this is what I want, because it has to be age appropriate, has to be interactive, and they need to have some input in what's going on with their children's sex education.
Well, you guys have convinced me. I used to be pretty conservative about this stuff, and you guys convinced me how important this was with regard to unwanted pregnancies and STDs. Bestiality, if a teacher talked to my kid about bestiality, I would kill somebody.
That's not appropriate.
Why is that even on the curriculum? And if you are a parent of a child that's in a school with that curriculum, how can you protect them?
You have to get involved with the school. That's why they have the opt-out programs. They think that the parents are going to not notice that it's time for sex ed and not be able to say, okay, I don't want to get involved in this, or opt my kid out. But you have to get involved because there is no standardization, parents, because just because the school is starting down the right line and saying, yes, we have sex ed, they may not have the proper program. And that needs to be standardized all across the board, and it's not done yet.
In the end, would everyone agree that there are limits that we need to place on sex education?
Yes, absolutely.
Absolutely.
Sex education has to be there, but with the approval of your parents, and maybe more as just a starting point, because it's also up to the parents, too.
Dr. Lisa, what's the best age to start talking to your kids?
Actually, anytime you can, find that moment to talk to them about their bodies, because the more they're going to feel good about their bodies, the more they're going to stay away from, they're going to, abstain from sex as long as they can. They're going to have healthy relationships, and that's the key. We want them to become healthy, happy adults, and finding out about that is great. Around 8 to 10, especially when girls are, about to start getting their periods and things are changing in the bodies for boys and girls, so that they know what's happening, and that segues into these normal things going into sex, and that's how it should happen.
Sex is kind of like food in a way. Food can be really bad for you or really good for you. Sex can be really bad for you or really good for you. It just depends on how you treat it.
Yeah, I mean, certain STDs are forever.